Well, it's a pleasure to welcome everybody to Greetings from the GREC, the Government Relations and Economics Committee podcast of ACRO. I'm Chris Jahraus, and I'm the host for this evening. And today we have, or for today, and we have along with us Jason McKitrick, the Legislative Counsel for ACRO, and we have Dr. Gordon Koltis. And I think Jason is going to be speaking with us a little bit about a quick update on things in DC. And then Gordon is going to talk a little bit more about how we can get involved in the legislative process as legislative lay people. So, with that, Jason, will you lead off?
Yeah, I'm happy to. Thanks, Dr. Jahraus. We are off to a pretty quick start for 2026. We've already got some legislative activity happening here in the Congress, and folks will recall that not too long ago, the government was shut down relating to, among other things, this enhanced premium tax credit for ACA coverage. And that was, if you rewind even back a little bit further last year, the context of that is got a lot to do with the reconciliation bill, the HR 1, that did a number of things relating to Medicaid primarily, but also was noteworthy for what it did not include. And again, it did not include these enhanced premium tax credits for ACA coverage. It also did not include a permanent update to the conversion factor. What it instead included was a 2.5% temporary 1 year update for 2026. And so when the government shut down last year, um, in October, there was a shutdown between October 1 and November 12th. It resulted in, among other things, the work gypsy floor expiring, as well as some of the telehealth flexibilities expiring.
Can you just
Um,
remind everybody
yeah,
what the gypsy floor is for those who may not be as familiar?
yes, absolutely. It's the Geographic Practice Cost Index, and they are those indices are throughout the physician fee schedule, and they adjust your reimbursement based on your locality. Sometimes they're higher than one, sometimes they're lower than one. In the cases where they're lower than one, that's problematic, and so the floor tries to raise those up to one. And they've been doing that for man, for as long as I can remember, many, many years. And there's every expectation that that ultimately will get extended again. But it sure was problematic, both in the case of that gypsy as well as the telehealth flexibilities when those things expired, because a lot of the claims that were associated with those provisions were kind of in a holding pattern. And so the bill that got us out of the shutdown, that was HR 5371, and that opened up the government again, extended these extenders through January of 2026. And where we are today, as of right now, the House has passed HR 1834, excuse me, to extend those enhanced premium tax credits through 2028. Our best analysis right now is that that bill is unlikely to pass the Senate, so we'll have to see what the Senate does. We're cautiously optimistic that ultimately this does get figured out, and we don't have another shutdown, and that as part of that, those extenders go through the end of this year. What that would tee up is then, I mentioned again that in the HR 1, the reconciliation bill, that permanent update to the conversion factor was left out. It was just a 1 year bump. Well, at the end of 2026, that 1 year bump goes away. And so what providers are going to be looking at is a 2.2% cut in 2027 to the conversion factor. So what's going to play out, it seems, between sort of now and the end of the year, assuming that they do get this package done and we get some extenders, is some hearings, some markups potentially. There was already some legislative activity at Energy and Commerce, largely unrelated to our stuff, but there could be some additional hearings and markups in the authorizing committees in Q1 and Q2. We've heard that, among other things, structural reform of the physician fee schedule is something they're thinking about. That could include radiation oncology payment reform, rocker, or other kinds of similar provisions. We'll see. And that this would all sort of lead up into a package at the end of this year after lame duck. And so that's sort of the current state of play for Congress right now.
Well, Jason, I want to thank you for that update. That's very useful information and helps us really better assess the news as it comes along and how it will impact us as physicians and even as radiation oncologists. So we know that really being a part of the process is important, that we've got to have a voice in the process or we get left out. And so we have with us today Dr. Gordon Koltis, who himself has been very effective and has certainly benefited ACRO and radiation oncology writ large in his assistance with getting attention for the things that we need. Gordon, can you tell us just a little bit about yourself and then give us some suggestions of how we can become more active and engaged?
Thank you, Chris. Well, the short story is, I'm sure most people know, I'm a radiation oncologist. I've been in practice for many years, including, in academics as well as in private practice. And I think that the point here between the message we try to get across as the GREC, the Government Relations and Economics Committee, is the point of relations is one needs to establish a relationship with our congressmen and senators. And in order for us, I think, to have an impact on not only what may benefit us in the economics portion of healthcare, but to be able to establish a relationship with our representatives. And that means participating in functions that will actually bring us right in front of them. A relationship isn't much of a relationship if you send a text or send a message, but to actually participate in an event where you can actually meet, shake hands, speak with your representative is critically important.
Gordon, I think a lot of people don't necessarily know what's out there, what's accessible to them. Can you just maybe mention briefly, what do Congress people have available that you can go to and engage with them on?
Well, we largely, at least as far as ACRO and the GREC goes, we largely receive notifications and information directly from Jason, who will be in contact with various staff members and fundraisers and the such, who will then let us know when our representatives may be having a fundraiser or an event which is active in our area. Now, I've traveled to Washington, D.C. in the past to meet directly with people on the Hill. ACRO advises us when there are times, and other professional organizations, when there are times when there are events that are going on in DC itself where we can participate and actually be in front of our congresspeople to speak. But I think that going to some of their local events is even more important. Usually smaller groups, you get a little more time to actually speak directly to your representative, not only to let them know what is affecting us business-wise, but professional practice-wise, but how healthcare law has an impact on how we can take care of our patients. Because we are in the practice of medicine. And while medicine is business and it's big business, ultimately we try to make sure that we can affect inspiring and incentivizing and supporting our representatives to participate in helping us give a result of quality health care. And we need to do that. We need to support them. And they, in turn, will hopefully make an impact on what we can do as practitioners in this field.
And Dr. Koltis, I can tell you, from the sort of lobbyist point of view, having folks in the district like you, Dr. Jahraus, like you, Dr. Koltis, who I know have established relationships with your members of Congress, it's so different than what I do. What I do is, it's got its place, but ultimately, these members of Congress are responsive to their constituents, And it's why it's so important, the work that you two have already done to get to know your members of Congress, to support them, to educate them from a constituent perspective. It's just essential to helping the college, helping what I do. And so I'm grateful for both of you and your efforts.
So, Jason, let's say that we've got a young or mid-career or late career, anybody, radiation oncologist that just says, "Yeah, I really need to do more of that." But maybe they don't have a relationship with their congressman or senator or whichever. How can they reach out to you and just
Yep.
say, "Hey, I'm available," or what's the best way to get involved for the benefit of ACRO and radiation oncology as a whole?
Yep. I'm so glad you asked that, because there is certainly, I think, and I've heard this from many, many folks in ACRO that I've talked to over the years, that kind of like what you just said, that a doctor will come to me and say, I'm interested. I do want to get involved, but how do you do it? It's a complete mystery to me how any of this works. And, you know, one thing we can do, that I've done, is, connect an ACRO physician to their local congressman's fundraiser. And so that will allow them to find out when upcoming events are. And they, and then this has been done, they would go to the event, and then they'd get to know the member if they don't know them, or support them if they, know them and they like them. And that's really an integral part of the process. It's not the only thing. Obviously, there are other ways to get to know your member of Congress, to attend local things at the county fair or whatever kinds of things that they're doing in the district.
But
Um,
would you say that going to a fundraiser is potentially helpful? I mean, obviously, there's no quid pro quo or anything like that. But do you feel like you get a little bit more time with a congressman or senator at a fundraiser, or what do you
well,
suggest?
yeah, I mean, I would say that any support from a constituent is something that any member of Congress, of course, is going to appreciate. That's why they're there. That's what they do. They are literally representatives. That's what they do. It's also a fact that we have a campaign process that it seems like every year it gets more and more expensive. And so these folks to run in campaigns and to represent the folks that they cherish to do, they need support, not just in terms of votes, but they need financial support to campaign. And so any support you give is helpful. The fundraising thing is, as I said, is a part of that process. And for the folks that do want to do that, we are very able to get you connected to the folks that can help you do that. For the folks that's kind of just a mystery, we can demystify that for you very easily.
Well, thank you. Gordon, do you have any other thoughts on this to add?
No, I just would reemphasize the importance of a relationship, which is a face-to-face relationship, real grassroots. It really makes a difference. And if you are a repeat participator, your representative recognizes you, you shake hands, you express some concerns, listen to what they have to say. They appreciate having their constituents listen to them, and we expect the same in return. That relationship, again, depends in part upon showing up more than once. This is a continuous process. It's not a one and done. And I think that we all can benefit in the quality of health care, and our ability to be able to do our jobs is directly related to the relationship that we have with
I
our
like that
congressman.
word. It sounds like it's a marathon, not a race, and something that you develop longitudinally over time. Well, I want to thank both of you for being here today and for sharing your wealth of experience with us. For now, this is Chris Jahraus, and we send you greetings from the GREC.